Okay, filming my notes for my persuasive speech. And my audience members, thank you guys for coming. Smile, wave. You're the stars. Okay, and I'll turn it over to Betsy. All right. Hi. You want to grab a sheet? That'd be awesome. Just, thanks, Steph. Some of you may know, or you may not know, that nursing facilities or nursing homes are the most highly regulated healthcare facilities within the United States. Not only that, nursing facilities are actually more regulated than nuclear power plants. And this, Chris McDaniels in 2009 cited this in his article about regulations for skilled nursing facilities. I'm Sarah Watkins. I've been working in long-term care for roughly 20 years. Currently, I'm an RN working on my BSN. The cost of living in nursing homes has risen to above $80,000 in the past year. Now, granted, that's covering the whole United States and averaging the costs of medication, costs of room and board, costs of everything. But as you can see, that's a big chunk of money. And this was cited in CNN's Money magazine in 2013 in the article, Nursing Home Costs Exceed $80,000 in a Year. We're gonna discuss today the history of nursing home regulations, where we are today with nursing home regulations, concerns over types of regulatory implementation, and discuss possible solutions for the heavy burden of regulation. One of my points today is the history of regulation. We can trace this back to the 1950s. In the 1950s, we started seeing nursing homes becoming more commonplace, more of the medical model. And there really wasn't any oversight, government oversight. By the 1960s, Medicare and Medicaid were coming into play, and they were not giving, but they were, that's how nursing homes received many of its resources and payment. As a result of this, the federal government and state governments needed to start regulating where their money was going and that people were appropriately cared for. So basically in the 1960s, our regulations began. In the 1970s and 80s, researchers presented evidence that frail, vulnerable adults were living in nursing homes and maybe not receiving the most quality care throughout the United States. So at that time, the Omnibus Budget Reconciliation Act was published in 1987. In the industry, it's known as OBRA 87. Basically, what that was, it was a study of all the findings that they found within nursing homes. And not only that, but solutions to they put regulations in place. This was evidenced written by Stiller in 2010's article. Roughly 3 years after 1987, 1990, these regulations were put more strictly into place. With this action, we have seen some increased quality of care across the United States in nursing homes. However, the price of living in a nursing home has skyrocketed as well. And the accessibility for people to come in and pay privately to live in a nursing home has diminished a great deal. The importance of this point includes assuring quality care for people living in nursing homes, and secondly, keeping it affordable for people who need the care. Nursing homes want to provide quality care, but some are spending much of their time and resources on jumping through hoops or trying to meet all the regulations and taking time away from actual bedside care. For example, the increased time and documentation requirements has taxed staff's time and resources to provide the direct care. Assessments needed for why things are to be done and when they are to be done to meet state standards is needed by each nursing home for each resident. State requirements for what's submitted to the state for documentation and how the nursing homes receive payment is a heavy burden to all nursing homes. Surveys are conducted unannounced anywhere from 9 to 15 months for our nursing homes. Facilities are watched by surveyors, and if the regulations are not followed, deficiencies follow, or possibly even fines for the facility. This again takes people away from the bedside, focusing more on meeting the regs than caring for the resident. An example of this is each person living in a nursing home is required throughout the year to have quarterly assessments, which are called MDSs. They take a great amount of time. This is also how the nursing home gets paid. However, nursing homes basically are required to have staff and allocate time to put people into that documentation role, whereas those people could be caring for people at bedside had that been a different program. Regulatory theories. Theorists often divide regulation into two separate kinds. And deterrence is the first one. And these type of regulators typically see organizations as a whole, people who want to get away with things. When the cat's away, the mice will play, sort of thing. And their approach is very formal, legalistic, and punitive. The other type that theorists talk about are compliance type regulations. We see those more as teachers, people who want to develop people and approach more informally to teach and in a supportive manner. This is brought up in Kohler 2011 article. And the US typically especially in nursing homes, we see the deterrence model where if something is found wrong, deficiencies are cited, punitive actions are happening. It's a very formal system, and a lot of times it contributes to a division between the regulators and the providers. Ultimately, maybe not the best solution when they could be working together for the good of the residents. The importance of this problem is, again, to increase quality of care and keep regulations realistic for facilities to navigate. The two schools of thought on regulation reform. One is to tighten and tougher standards for more aggressive enforcement. Others believe the current regulatory burden is too great and they should simplify it and focus mainly on problem nursing homes. Nursing home regulation is clearly necessary, but not all regulation is good and effective. We could learn from looking at other industries and other countries for the effectiveness of the regulations. Who's affected? Roughly 1.6 million Americans live in nursing homes. This is cited by Dottie in 2008. As stated earlier, it costs roughly $80,000 for a person to live in a nursing home per year. Typically with nursing home care, you think of elderly persons. However, we're seeing many, many more younger people living longer with chronic diseases, children who are born with birth defects, people who are in accidents, chemical abuse situations, where in the last decades people would not have lived through, are living and needing to be placed in some sort of long-term care. So it's not only our elderly people living here, it is people across the generations. Typically in interviews, when I interview people for a position here, much of the time people say, when asked the question, what is what's the most challenging part of your job, especially caregivers, if they've worked in a place before? And I would say 8 out of 10 times they say that they're not able to spend the amount of time at the bedside that they would like to spend. We've covered many problems, and we understand that nursing homes are very highly regulated, and let's look at how we could possibly improve and a solution for this highly regulated field. All right, solutions. As we've kind of covered already, moving from deterrence to compliance model of regulation would be a really step in a good direction. This solution fits the problem of present day regulation, not fully improving quality of care, and we still need regulation in nursing homes, but this is a different type of regulation. It would be able to be delivered and people would learn from it and not be so intimidated and scared by it. In the compliance model, regulators are supportive, looked at as a teacher. They're not like police looking to punish. This would allow for more resources ultimately to be freed up, and there would be a team effect between the regulators and the providers. This solution could be implemented with changes in government policy. OBRA 87 standards are good, however, the approach of regulators and measurement of standards would need to change. The money costs of this would be great to make this change. However, in the long run, after the regulation, we would hope we'd see a decrease because of the less strict and tight surveillance. Punitive regulation of nursing homes is strict and not necessarily effective in our meeting quality of care. It has improved, and quality of care is good in nursing homes in Minnesota. However, we're always striving to do better. Implementing a compliance type regulatory system with stronger relationships between regulators and providers would be effective. Billions of Medicare and Medicaid dollars are spent annually on the care of people in nursing homes. The taxes you pay are going to provide this care. Don't you think the money that you send for your taxes you would like to see used in the most effective way possible? Nuclear power plants are less regulated than nursing homes. They are achieving the outcomes they wish to achieve. Nursing homes are more regulated and not necessarily achieving all the outcomes they are expected from the public. Clearly the answer is not the amount of regulation, but the type of regulation. Any questions?